Hey everybody, it's Dr. Jess. The Raiders start their season opener on Saturday, August the 10th, but unfortunately it looks like they will be short a player. Antonio Brown, Raiders wide receiver, unfortunately suffered severe frostbite to both feet during a cryotherapy session gone wrong. Cryotherapy came out years ago, but has recently been made popular by athletes such as Steph Curry and LeBron James. Whole body cryotherapy, or in other terms, cold treatment or cold therapy, is a treatment that exposes the body to temperatures of negative 150 to negative 200 degrees for approximately 2 to 4 minutes. Cryotherapy is a cool way to kind of trick your body into sending oxygen and increased blood supply to muscles and tissues where normally it wouldn't have, which is why athletes typically do it after a workout. What happens here is that during the session, the blood vessels vasoconstrict, meaning they get smaller or more narrow. During this session, your body is triggered to increase the amount of nutrients and increase the amount of oxygen to the blood vessels after the session, therefore helping to speed up the recovery time, which is why a lot of athletes now do it, especially professional athletes. During each session, depending on the facility, athletes are given gloves, socks, slippers, a face mask, earmuffs, and underwear to protect their skin. Unfortunately, however, not everyone chooses to use the equipment given, therefore leading to conditions of extreme cold like frostbite and frostnip. Frostbite is a cold injury and usually affects extremities like the fingers, the toes, nose, ears, and it usually is seen in the homeless population, elderly, outdoor workers, the population that is unable to protect themselves on a regular basis from cold temperatures or extreme cold temperatures. The risk usually comes in when people are exposed to temperatures, ambient temperatures of less than negative 20. So when you think about these cryotherapy clinics and these cryotherapy sessions that these athletes are going into, they're exposing themselves to negative 150 to negative 200 degrees at times, even though for a short period of time, it's extreme cold and it could definitely cause issues within a short period of time. Within frostbite, there are 4 different classifications. There's 1st degree, 2nd degree, 3rd degree, and 4th degree. With 1st degree, patients typically get a partial freezing. They'll come in with symptoms of burning and stinging, but typically they don't have a whole lot of pain with this, and they're rewarmed and able to go home, no problem. 2nd degree is a full thickness freeze. It also results in numbness, aching, throbbing, but with 2nd degree, you also get edema and what's called desquamation, which is almost like a peeling of the skin, followed by the scarring that occurs. Although it sounds painful, it can sometimes be mildly or moderately painful, the prognosis is good, meaning the outcome will ultimately be a good outcome. There won't be any kind of amputation or anything like that will be necessary. With 3rd degree frostbite, there is tissue loss involving the entire thickness of the skin. The extremity feels almost like a block of wood. You get the throbbing and the numbness and the aches and the pains with this as well. You also will get a blister, but with this blister, there's blood inside. It's called a hemorrhagic blister. Skin necrosis and like a blue-gray discoloration of the skin. Unfortunately, the prognosis for this is typically poor, meaning it's not gonna be a good outcome. With 4th degree frostbite, you get extension into the subcutaneous tissue, bone, tendon, muscle, and patients typically experience this deep aching joint pain. The prognosis for 4th degree frostbite is horrible and typically ends in a poor prognosis, meaning the outcome will not be good. So what type of frostbite did Antonio Brown have? After looking at the pictures and images he posted to his social media account, it appears he may have had a 2nd degree frostbite. However, one cannot be sure initially. It does take some time to figure out the extent of the injury, sometimes up to 6 weeks. Even if he did have 2nd degree frostbite, you can't say this early how extensive his ultimate injury or symptoms, long-term symptoms will be. He may have numbness and issues with sensation. One can't really tell until he's reassessed after a full diagnosis is made. So good luck to Antonio Brown. All of you guys who are doing cryotherapy, please wear safety equipment that's given. Wear the gloves, wear the booties, wear the mask, put on all the protective gear so that you don't have to suffer the cold injuries that come with submerging your body into these negative 150, negative 200 degree temperatures. Good luck. Please subscribe, follow me on Instagram, Twitter, Facebook, whatever else is out there, at Dr. Jess, and subscribe to my channel.